What if I told you that 4 simple mistakes you're making every single day are slowly suffocating your lungs, making every breath harder than it needs to be, and that you could fix all 4 of them in the next 24 hours without medication, special equipment, or doctor visits? Right now, millions of people over 50 are unknowingly sabotaging their breathing through common habits that seem completely harmless but are actually constricting airways, weakening breathing muscles, and stealing lung capacity breath by breath. These aren't obvious mistakes like smoking. These are things you're doing right now, today, thinking they're normal or even healthy, while they're silently destroying your ability to breathe easily. This isn't about rare conditions or complex medical problems. This is about 4 everyday mistakes that nearly everyone makes, mistakes so common that most doctors don't even mention them because they assume everyone does them. But the small percentage of seniors who discovered these mistakes and corrected them experienced transformations that seemed miraculous. Breathing that had been getting harder for years suddenly became easier. Activities that left them gasping became effortless. Lung capacity that was declining started improving. All because they stopped doing 4 simple things wrong and started doing them right. In the next few minutes, I'm going to reveal the 4 breathing mistakes you're almost certainly making right now. I'll explain exactly why each one makes breathing so much harder and what damage it's causing to your respiratory system. Then I'll show you the simple corrections that fix each mistake immediately, often producing noticeable improvement within hours or days. These corrections require no money, no special tools, no prescriptions. Just awareness and small changes to habits you've had for so long you don't even think about them. Your breathing could transform starting today if you know what to stop doing and what to do instead. If you're over 50 and your breathing has gotten progressively harder over the years, you've probably blamed aging, maybe past smoking, environmental factors, or just bad luck. You might have assumed that struggling to breathe is just what happens as you get older and there's nothing you can do about it except take medications and accept the decline. But what if a significant portion of your breathing difficulty isn't from irreversible damage or inevitable aging? What if it's from 4 correctable mistakes you're making every single day that are actively making your breathing worse? Here's the frustrating truth that most people never discover. Yes, aging affects lung function. Yes, past exposures can cause damage. But in many cases, the biggest factors making breathing difficult aren't these unchangeable things. They're modifiable habits and mistakes that you have complete control over. The problem is that nobody teaches you what these mistakes are. You learned to breathe automatically as an infant, and you've been breathing the same way ever since, never questioning whether you might be doing it wrong. Meanwhile, these 4 common mistakes have been making every breath harder, weakening your respiratory system, and accelerating decline year after year. Most doctors don't address these mistakes during brief appointments. They prescribe inhalers or other medications to manage symptoms but rarely take time to assess and correct the fundamental breathing mechanics and habits that are causing the problem. Physical therapists and respiratory therapists who specialize in breathing know about these mistakes and routinely correct them with patients, often producing dramatic improvements. But unless you're sick enough to be referred to specialized therapy, you never learn what you're doing wrong. Thousands of people who finally learned about these 4 mistakes and corrected them described the experience as life-changing. Breathing that had been a constant struggle became easy again. Energy that had been drained by the effort of breathing returned. Activities they'd given up became possible again. Quality of life transformed completely. The most amazing part is how simple the corrections are. These aren't complicated interventions requiring months of training. These are adjustments you can make right now, today, that will start improving your breathing immediately. Let me reveal the 4 mistakes that are making your breathing harder every day and explain exactly why each one is so damaging. Mistake number 1 is breathing through your mouth instead of your nose, especially during sleep and exercise. This is perhaps the most common and most damaging breathing mistake that almost everyone makes without realizing it. Your nose is specifically designed to prepare air for your lungs. It filters out particles and pathogens, warms cold air to body temperature, and humidifies dry air to the perfect moisture level for your delicate lung tissues. Your mouth does none of these things. When you breathe through your mouth, you're sending cold, dry, unfiltered air directly into your airways. This causes several problems. Cold, dry air irritates and inflames your airways, causing them to produce excess mucus and constrict to protect themselves. This makes breathing harder and triggers coughing. Unfiltered air carries more allergens, pollutants, and pathogens deep into your lungs, increasing inflammation and infection risk. Mouth breathing also changes the position of your tongue and jaw in ways that narrow your airway, especially during sleep, contributing to snoring and sleep apnea. Over time, chronic mouth breathing leads to chronic inflammation, increased mucus production, more frequent infections, and progressive airway narrowing. Many people don't even realize they're mouth breathing. They do it automatically during sleep without knowing. They switch to mouth breathing during any physical exertion because it feels like they can get air faster that way. Some people have been mouth breathing for so long that nasal breathing feels difficult or uncomfortable. But every breath through your mouth instead of your nose is making your respiratory system work harder and causing damage that accumulates over time. Mistake number 2 is shallow chest breathing instead of deep belly breathing using your diaphragm. Most people over 50 breathe primarily from their chest, using only the upper portion of their lungs. They take quick, shallow breaths that barely move their diaphragm and never fully ventilate the lower lobes of their lungs where the most efficient gas exchange happens. This pattern develops gradually over years, often without awareness, until shallow breathing becomes habitual. The problem is that shallow chest breathing is incredibly inefficient. You're moving air in and out of just the upper airways, the least efficient part of your lungs for oxygen exchange. You're not using your diaphragm, the powerful muscle that's supposed to do 70% of breathing work, so it weakens from disuse. Your lower lungs, which have the richest blood supply and best oxygen exchange, barely get ventilated. You end up breathing faster to compensate for the inefficiency, which means you're working much harder for less oxygen. Over time, this leads to a weak diaphragm, reduced lung capacity, and constant feeling of breathlessness even with minimal exertion. Mistake number 3 is maintaining poor posture that compresses your chest cavity and restricts lung expansion. Many people, especially as they age, develop forward head posture, rounded shoulders, and a curved upper back. They spend hours sitting hunched over computers, phones, or just relaxing in positions that compress their chest. This postural collapse physically restricts how much your lungs can expand. Your ribcage is designed to expand outward and upward to create space for your lungs to fill. When you're hunched forward with rounded shoulders, your ribcage is compressed and can't expand properly. The consequences are significant. Even if you're trying to breathe deeply, poor posture prevents your lungs from filling completely. You might be taking in 30 to 40% less air with each breath simply because your body position won't allow full expansion. Your breathing muscles have to work much harder to overcome the mechanical disadvantage. Over time, the muscles and connective tissues in your chest adapt to the compressed position, becoming stiff and resistant to expansion even when you do try to straighten up. Breathing becomes progressively more difficult as postural collapse worsens. Mistake number 4 is chronic dehydration affecting mucus consistency and airway function. Most people over 50 don't drink enough water throughout the day. They might have coffee in the morning, maybe some other beverages with meals, but they're not consistently maintaining proper hydration. This has a direct and dramatic effect on breathing. The mucus that lines your airways and protects your lungs requires adequate hydration to maintain the right consistency. When you're dehydrated, that mucus becomes thick, sticky, and difficult to clear. Thick mucus clogs your smaller airways, reducing airflow and making breathing harder. It's difficult to cough up, so it sits in your lungs creating obstruction and breeding grounds for bacteria. Your airways have to work harder to move air through the narrowed, mucus-clogged passages. Your cilia, the tiny hairs that sweep mucus out of your lungs, can't function properly when mucus is too thick. Over time, chronic dehydration leads to chronic mucus problems, recurring infections, progressive airway obstruction, and increasingly difficult breathing. The consequences of making all 4 of these mistakes simultaneously, which many people do, are severe and cumulative. Your mouth breathing cold, dry, unfiltered air that inflames your airways. You're breathing shallowly from your chest, never properly ventilating your lungs. You're hunched in positions that prevent full lung expansion. You're dehydrated, so your mucus is thick and your airways are obstructed. Every single breath is harder than it needs to be. Your lungs are under constant stress. Inflammation becomes chronic. Capacity declines. Infections become frequent. You feel breathless with minimal exertion and assume it's just aging when it's actually these 4 correctable mistakes compounding each other. Now let me show you how to fix each mistake starting right now. Correction for mistake number 1, nasal breathing, is to consciously practice breathing through your nose throughout the day and to ensure nasal breathing during sleep. Start by simply paying attention to whether you're breathing through your nose or mouth right now. If your mouth is open, close it gently and breathe through your nose. Practice this awareness throughout your day. Every time you notice yourself mouth breathing, especially during physical activity, consciously switch to nose breathing. For sleep, which is when most people mouth breathe without realizing it, you can use a simple technique called mouth taping. Use a small piece of medical tape or special mouth tape designed for this purpose and place it vertically over your closed lips before bed. This gentle reminder keeps your mouth closed during sleep, forcing nasal breathing. If you're concerned about this, start by just taping during daytime naps so you can monitor how it feels. Most people find that within a few nights of nasal breathing during sleep, they wake up feeling more rested, with less dry mouth, less morning congestion, and easier breathing. If nasal breathing feels difficult because your nasal passages seem blocked, this is often because years of mouth breathing have allowed your nasal passages to become congested and inflamed. Using a saline nasal rinse twice daily can clear this congestion. As you practice more nasal breathing, your nasal passages will adapt and open up, making it easier. Within weeks, nasal breathing will feel natural again, and you'll notice breathing is easier, you're getting sick less often, and your airways feel less irritated. Correction for mistake number 2, shallow breathing, is to retrain yourself to breathe from your diaphragm. Several times throughout your day, stop and do this simple exercise. Place one hand on your chest and one hand on your belly. Breathe in slowly through your nose, focusing on making your belly hand rise while your chest hand stays relatively still. This ensures you're using your diaphragm. Exhale slowly and completely. Do this for just 2 minutes several times a day. As you practice, diaphragmatic breathing will gradually become more automatic. You can reinforce this by practicing whenever you're sitting, lying down, or doing light activity. The goal is to retrain your default breathing pattern from shallow chest breathing to deep belly breathing. Within a few weeks of consistent practice, most people find their breathing has become naturally deeper and more efficient. They're getting more oxygen with less effort. Activities that used to leave them breathless become easier because their breathing is finally working efficiently. Correction for mistake number 3, poor posture, is to consciously maintain upright posture throughout the day and to do specific exercises that counteract postural collapse. Start by simply being aware of your posture. Set reminders on your phone to check your posture every hour. When the reminder goes off, sit or stand up straight, pull your shoulders back and down, lift your chest, and tuck your chin slightly to align your head over your spine. This is the position that allows maximum lung expansion. Also practice this simple daily exercise. Stand against a wall with your heels, buttocks, shoulders, and head all touching the wall. Hold this position for 2 minutes while breathing deeply. This reinforces what proper alignment feels like and stretches the muscles that have adapted to poor posture. Do this twice daily. Additionally, practice shoulder blade squeezes throughout the day, pulling your shoulder blades back and together, which opens your chest. These postural corrections don't just improve breathing, they also reduce back pain and improve overall function. Correction for mistake number 4, dehydration, is straightforward but requires conscious effort. Drink water consistently throughout the day with a specific target. A good baseline is 8 8-ounce glasses, which is 64 ounces total. If you're not used to drinking this much, start by adding just one extra glass per day and gradually increase. Keep a water bottle with you and take sips regularly rather than waiting until you feel thirsty, which is already a sign of dehydration. You can track your hydration by checking your urine color. Pale yellow indicates good hydration, while dark yellow means you need more water. Within just a few days of proper hydration, most people notice their mucus becomes thinner and easier to clear. Morning congestion improves dramatically. Coughing becomes more productive instead of dry and irritating. Energy improves because your body is no longer struggling with the effects of chronic dehydration. Let me tell you about George, a 65-year-old man who had been struggling with progressively worse breathing for 7 years. He could barely walk from his car to a store entrance without stopping to catch his breath. His doctors had diagnosed him with chronic obstructive pulmonary disease and prescribed multiple medications, but he continued to decline. George had resigned himself to progressive disability and eventual oxygen dependence. Then George was referred to a pulmonary rehabilitation program where a respiratory therapist spent time observing how he actually breathed. She noticed immediately that George was mouth-breathing constantly, even at rest. He was taking rapid, shallow breaths using only his chest. He sat hunched forward with terrible posture that compressed his chest. When asked about his water intake, George admitted he probably drank 1 or 2 glasses of water a day at most, relying mostly on coffee. The therapist explained that while George did have some lung disease, he was making all 4 major breathing mistakes, which were making his condition far worse than it needed to be. She taught George the corrections. She had him practice nasal breathing and gave him mouth tape for nighttime. She trained him in diaphragmatic breathing with daily practice sessions. She worked on his posture and gave him exercises to maintain better alignment. She set a hydration goal and had him track his water intake. George was skeptical that such simple changes could make a difference when medications hadn't helped much, but he committed to trying. Within 2 weeks, he noticed he wasn't waking up as congested. Within a month, he could walk farther without getting as breathless. After 3 months of consistently correcting all 4 mistakes, George's breathing had improved so dramatically that his doctor reduced one of his medications. His lung function tests showed improvement, something his doctor hadn't expected to ever see. George continues to maintain these corrections religiously because he knows from experience what happens when he slips back into old habits. He says that learning about these 4 mistakes and how to correct them gave him back his life. He's not cured of his lung disease, but he's managing it far better and functioning at a level he never thought he'd reach again. The key to success with these corrections is addressing all 4 mistakes, not just 1 or 2. They work together synergistically. Nasal breathing is more effective when you're also breathing deeply from your diaphragm. Good posture makes diaphragmatic breathing easier. Proper hydration makes nasal breathing more comfortable because your nasal passages aren't dry. When you correct all 4 mistakes simultaneously, the improvements in breathing are often dramatic and rapid. Respiratory therapists who work in rehabilitation settings report that correcting these 4 fundamental mistakes often produces more improvement in breathing than medications alone. Research on nasal versus mouth breathing has documented significant differences in airway inflammation, infection rates, and oxygen saturation favoring nasal breathing. Studies on breathing mechanics consistently show that diaphragmatic breathing is far more efficient than chest breathing and can be retrained at any age with practice. Postural research has demonstrated direct correlation between forward head posture, rounded shoulders, and reduced lung capacity. Correcting posture can increase measurable lung capacity by significant percentages. Hydration studies show clear effects on mucus viscosity and clearance efficiency, with properly hydrated individuals having much easier mucus clearance and fewer respiratory symptoms. The insider knowledge that specialists share is that most breathing problems in people over 50 are multifactorial, combination of some actual lung changes with significant contributions from these correctable mistakes. Yet most medical appointments don't address breathing mechanics, posture, or hydration because there isn't time and because doctors often assume these basic factors are already optimized, which they rarely are. Here's something that will change how you think about breathing difficulty. Research comparing lung function in people with similar degrees of actual lung disease has found enormous variation in symptoms and functional capacity. Some people with significant disease function quite well, while others with less disease are severely disabled. The difference often comes down to these 4 factors. People who breathe nasally, use their diaphragm, maintain good posture, and stay hydrated function far better than those who don't, even with the same underlying disease. The revelation that surprises people is how quickly corrections can produce improvements. Unlike medications that might take weeks to show effects, or lung healing that takes months, correcting these mechanical and habitual mistakes often produces noticeable improvement within days. Nasal breathing during one night of sleep can make the next morning dramatically better. One day of proper hydration can thin mucus noticeably. These are immediate changes because you're stopping active harm and allowing normal function to return. When you correct these 4 mistakes and experience easier breathing, the psychological transformation is profound. You feel empowered because you've discovered that you have control over something you thought was beyond your control. You feel validated because the breathing difficulty you've been experiencing wasn't all in your head or inevitable, it was caused by correctable mistakes. You feel hopeful because if breathing can improve this much from simple corrections, what else might be possible? People who successfully make these corrections describe feeling younger and more capable. Activities they'd been avoiding become possible again. Energy improves because breathing isn't exhausting anymore. Sleep quality increases. Mood lifts because constant breathlessness is psychologically draining, and its absence is liberating. Quality of life transforms when breathing shifts from being a constant struggle to being effortless again. We've covered the 4 mistakes making your breathing harder every day. Mouth breathing instead of nasal breathing, exposing your airways to cold, dry, unfiltered air. Shallow chest breathing instead of deep diaphragmatic breathing, using only your inefficient upper lungs. Poor posture compressing your chest cavity and preventing full lung expansion. Chronic dehydration making your mucus thick and your airways obstructed. We've revealed the simple corrections. Practice nasal breathing throughout the day and during sleep. Retrain diaphragmatic breathing with regular practice. Maintain upright posture and do exercises to counteract collapse. Drink adequate water consistently throughout the day. The question isn't whether these corrections work. Respiratory science and countless success stories prove they do. The question is whether you're going to start making these corrections right now, today, or continue making these mistakes that are stealing your breath. Here's what you need to do in the next 60 seconds. Close your mouth and breathe through your nose. Sit or stand up straight, pulling your shoulders back. Take a slow, deep breath into your belly, not your chest. Then go get a glass of water and drink it. You've just corrected all 4 mistakes for this moment. Now you need to make these corrections your new normal, practiced consistently throughout every day until they become automatic. Your breathing difficulty isn't entirely inevitable. A significant portion of it is caused by these 4 correctable mistakes. Stop making them starting right now. Breathe through your nose. Breathe from your diaphragm. Maintain good posture. Stay hydrated. These simple corrections could transform your breathing within days and your life within weeks. Make the choice now. Your lungs are waiting for you to stop sabotaging them and start supporting them. Begin this moment with your next breath.